Time now for this week's Health Matters. Paul Critz with PA Lynn Szabo. And we were getting all worked up before going live on the microphone.
I know, man. We're roaring.
And it occurred to me while I was reaching over here and doing levels and everything going to exactly how to approach this topic. So you have brought in Project 2025 and specifically to look at this document and what is being said amongst the peoples who, right now at least, are in the lead to take over this country of ours come next January, I guess. But about what it means for healthcare and health specifically, correct? That's what the topic is today?
In Del Norte.
In Del Norte, even more
I try to keep that in mind.
Excellent. So I want to come back to that sense of helplessness that we had and what we were talking about before going onto the microphone. At the end, help me remember that, if you would. I'll write something down to make a note. All right. Okay, so where do we begin with Project 2025 and our health?
So Project 2025 is written by the Heritage Foundation, which is a Christian nationalist group. And right now, as far as anybody can tell, it is the Republican platform.
Right.
For how they're going to govern.
Yeah, so, by default. Huh?
Yeah, it outlines a wide range of changes to the government and will have huge impacts on our daily lives. It's like a 800 or 900 page document. Mm-hmm. I went back to the source document to read it. I read some things that are certainly negative about it and some things that are many fewer things that were positive. Mm-hmm. And I was thinking, keeping in mind as I was trying not to vomit, how's this going to affect Del Norte? How's this going to affect Del Norte Community Health Center, UHS, Stallant, Sutter, and most of all the patients, because there are a lot of Medi-Cal and Medicare patients here in this community. And, what does this really mean for them? Okay. So I looked at 4 different major topics. And the first one is there's a huge focus on the elimination of abortion. Mm-hmm. I mean, they're obsessed with it.
Like outlawing?
Well, they're talking about nationally outlawing. But yeah, that's kind of a good question. Not only a broad national mandate, but also picking it apart, like being pecking it to death by ducks.
You mean like at the state level?
Yeah, going into minutia and making, totally irrational things not available for women. Right. So one thing this document talks about is a real emphasis in what they perceive as the loss of personal choice. And that was hard to actually see that in reality from what they were saying.
Start that again. So the Project 25 is presenting this change as a response to the loss of personal choice?
Yeah, their perceived loss of personal choice. So they're one of their most...
Their personal choice about what you do with your body?
Yeah.
That's some Orwellian BS right there. Wow.
Totally. Well,
see, this is the problem. I'm gonna be breaking things. We're only 3 minutes into this. Go ahead. I'm sorry.
Okay. And so not only are there sweeping mandate, but tiny regulations. They want to, and I'll just give you a couple of them. Okay. This is really mind-numbing reading. They want to promote fertility awareness as effective birth control.
Fertility awareness. What's that mean?
So that's where a woman pays attention to her cycle.
We're all on the rhythm method.
The rhythm method.
Oh, wow. Oh.
And they promote that as reasonable birth control.
Ask any Catholic how well that's worked.
Yeah. Come on into me at Team Clinic. I cross my fingers. I hold them up and I say, you're doing this?
Oh, my God.
So that's about 75% effective. So about 100 couples using it over the course of the year, 75 women will get pregnant.
Jesus.
That's not really birth control.
Wow.
So as opposed to the pill, where 92% effective, which means only 8 people get pregnant in the course of the year.
Okay.
So they're promoting that as effective birth control. They actually want actually announcements on the media and stuff talking about that. Mm-hmm. So they takes away insurance coverage of postcoital contraception. specifically Ella, which we talked about
Mm-hmm.
as a more effective choice. It also takes away option to take away insurance coverage for other kinds of birth control, including birth control that's available to teens. Forces the CDC to keep data on abortion, which is so weird to me because they won't look at gun violence, but they're
Right. Yeah.
So the CDC, and I'll talk about how they changed the CDC a little bit later. There will be no research allowed using fetal tissues.
Mm-hmm.
Now, fetal tissue is used, my understanding is mostly in vaccine research.
Wow, that's handy.
Yeah, I know.
Yeah. Wow.
Yeah, see how insidious this is?
Yeah.
So they, and they're targeting teens, they're targeting single women, and they're trying to promote a model of, a Christian family with a husband, a wife, and, fertility maximum, so a lot of kids.
Mm-hmm.
So there's no choice in that.
Wow.
There's no choice at all in that. I know.
Okay. Yeah. No. Go ahead. This is
They're
almost
also going
hypocritical.
to take the medical abortion away from women too, as well as surgical abortion.
Sure.
So you won't be able to get medical abortion pills from even offshore sources.
Wow.
Yeah. So the next thing is Medicare, and there's a lot more. I'm just picking out what catches my eye. So the next thing is for Medicare. A lot of people in this county have Medicare. I do. Mike Thornton did. But they're going to privatize it. They've wanted to do this for years. And I did look at some pro articles about privatizing Medicare, and they always say the same thing without data to support it, that it's going to make more competition is going to equal better consumer protection, lower prices.
Right. It's the old free market economy BS stuff. Yeah. Right.
But they're not. They also a little bit later say they're taking out any requirement to prove that the care that you're providing actually is effective care. All right.
Whoa. What's that mean exactly? How would that express itself?
We talked about functional medicine.
Yeah.
There you go.
Right.
It's back. And you don't have to prove that it's effective.
Yeah. Any snake oil that you can get on the list.
Hydroxychloroquine.
Wow.
Yeah. So the belief is that it's going to be cheaper for everybody and it's going to increase services, but they encourage Medicare Advantage plans. So this means a couple of things specifically for Del Norte. They want to make Medicare. So when you sign up for Medicare, you get a hospital portion of your insurance, and then you get going to the clinic portion, and then hopefully there's things included like that in medication, but that's not always the case. Or things like physical therapy, or talk to the nutritionalist, or just what we think of as important health care. So Medicare Advantage, you buy kind of a side plan, and what happens with that is hopefully you get your needs covered, but you have to compare plans. And maybe you have certain needs going in this direction and this plan is better, or or you have needs going in another direction, that plan is better.
And so functionally for the patient, the person, the human, the difference between these quote unquote plans is what? Cost?
It's cost and services provided.
Sure. But what's that? Okay, yeah, right. So that of course applies to the patient. But
okay.
So what's the how's this a bad thing? Breaking all of this up.
That's a good thing, but the default choice is Medicare Advantage, which is a capitalistic kind of plan, and they make it sound like it'll pay for your med. That's the hook. But I don't think it exists up here.
Okay, I'm not understanding what your criticism is of this system.
My criticism is that you default to this particular plan that doesn't exist in Del Norte.
Why doesn't it exist in Del Norte?
I think it's because of the small population base.
Okay. Well, I mean, I'm certainly I don't want to defend Project 25, but that doesn't sound like that's a Project 25 issue. That's a system right now issue, right?
It could be. But it's like, there's a reason we don't have Kaiser up here. So this is kind of could draw a parallel. It's an enticing plan. You get defaulted to it if you don't, if you're not like super literate and paying attention to the deadlines and stuff like that. And then you get sold a plan that you have to pay for that you can't use in the place you live.
Gotcha. Okay. So there goes any sort of access to healthcare, due process, any kind of down rights, any sort of healthcare rights, which was kind of where we were moving as a culture recently, but that seems to have stopped.
Right.
So, okay. I get it now.
Yeah. So that means you're paying for services you can't get.
Right. Or you have services and you have this whole thing, you're going to have to travel.
It's my understanding, not at this point.
Right.
Because I've talked to a lot of patients who said, yeah, it sounded great. I signed up for it, but
yeah.
None of the pharmacies accept it. It doesn't pay for what it said it was going to. There's no providers here that take it. And it becomes the default choice. Okay. Then proposed tax cuts. There's a lot of talk about tax cuts in other parts of this document. That's going to underfund Medicare.
What taxes are left to cut?
Yeah, that's it. That's a good question. Business taxes going down to 18%.
Okay.
So
oh wow! So they're halving now. Okay.
Yeah, that's the biggest one. So underfunds Medicare, which is already kind of wobbly. Okay, and it leads to what they call personal responsibility. They say people want this. Wow. Deductibles, share of cost, and overall higher prices to the consumer.
There you go.
That's going to affect Del Norte.
For my 80-year-old father, that'll be a big help. That personal responsibility, you sons.
Yeah. No, I remember working up here when Medicaid, which is called Medicare or Partnership now, you had to have $1 copay to go to urgent care, which was the setting I was in. Nobody had it. I never saw them collect it.
Oh, wow. Right on.
And, the rationale at the time, in the papers I was able to read was it would give people pride that they were contributing something, to their own personal upkeep. But Del Norte is pretty smart and certainly can be kind of passively aggressive when they want to be. And nobody ever had it.
Nice.
Nobody ever had the money. So
and we probably took pride in that. And I love that.
Yeah, we Del Norte did.
Yeah.
There you go. Okay. So getting on to Medicaid, okay, which is also called Medi-Cal and more recently Partnership, it proposed the funding to be state block grants, supposedly to increase local control. Okay. So what do you think is going to happen in California?
I have no idea. I imagine what would happen in California would be the same thing that's happening in California.
Well, I hope so.
It's what would happen in Mississippi that would worry me.
Right. But, there's also Northern California and Southern California.
That's true.
And I think Southern California interests might prevail because there's a larger number of people affected and Northern California might have fewer choices.
So how's it funded?
That's a guess.
How's it funded now? How would that be different from the block funding?
Well, the difference between a block grant and then the funding now is funding now comes with a lot of strings. And you have to do this. You have to do that.
And is it per program sort of thing? Okay.
Yes. And you have to give more money to people that are underserved.
Okay. You got to be fair. You got to be more than fair about it.
Right.
I got you. Okay. Yeah,
okay. So that would disappear.
Wow.
They talk about that disappearing and making it even for everybody.
And we know here in Del Norte County just how responsive, how much time it can take Sacramento to remember that we're up here too.
Right.
So maybe when they're divvying up the healthcare pie.
This directly affects us because Partnership get the community clinics. So UIHS, Del Norte Community Health Center, and Stellant all get more money per patient. I think it's visit because we are underserved and we have to provide more services.
You have to be incentivized. Those services have to be incentivized for the people.
Exactly.
Coming here.
That's why they spend a lot of time trying to keep people out of the ER because it eats up some of the money and stuff like that. So I think that's going to affect the community clinics greatly. Del Norte Community Health Center and the open door system kind of climbing out of a budget deficit right now. UHS is sitting pretty, and I have no idea what's going on with Stellant. And I don't even know if Sutter Community clinic, if that's what we used to call a 95-210 clinic, it did have that associated with the urgent care that existed, but the urgent care doesn't really exist.
What was a 95-210 clinic?
95-210 clinic was the beginning of this pay differential for people who were underserved.
Okay.
So they got more money.
Gotcha.
And it was a big deal at the time, because my understanding was that provider or the clinic would get like $250 as opposed to $18.
Mm-hmm.
It was a huge differential.
Mm-hmm.
So I know when Redwood Urgent Care was trying to finally set up with Medicaid, they got offered $18 a visit.
Wow.
And that includes everything.
Wow.
So x-rays, sutures, splints, all of it.
Huh.
But at the same time, the urgent care that Sutter had, my understanding was it's not, that could be faulty, got about $254 for the same idea.
This is an aside, and we don't have to go into it now, but why that discrepancy between those two entities?
Well, because one had special dispensation from the federal government and recognition as an underserved, meeting the needs of an underserved community. Mm-hmm. And Redwood Urgent Care wasn't that sophisticated or
Gotcha.
Didn't have the grant writers or the staff or actually, that was run by physicians and they had no idea about the financing.
Wow. Okay.
So big surprise. Big emphasis on decreasing care to transgendered individuals. I mean, they talk about LGBTQ plus communities just not fitting their model of the heterosexual married Christian couple raising a family. Mm-hmm. So transgendered individuals, big at risk. Decreased, okay, so the next thing is I'm talking about the enhanced rate. We just talked about that. Adding a work requirement and adding copays and deductibles.
A work requirement for what?
To get Medicaid.
Wow.
You have to, it's kind of like when you get unemployment, you have to turn the little thing in weekly and say that you've been looking for a job.
Yeah.
We could dildo our way out of that one too, but I don't know if that means that people are going to be cut off. What if somebody is postpartum from a complicated delivery and really can't work at McDonald's?
Wow.
Even for 10 hours a week.
Yeah. How do you step up and take pride in that?
The Christian nationalist in this document is all about like personal responsibility and anybody with money not paying for anybody who doesn't have money.
Sure.
It's a common theme through 900 pages.
Wow.
It takes away the Affordable Care Act subsidies and funnels this money to private insurers. Okay, so if you ever sign on the exchange, I think you probably did this.
I am exchange.
And, they talk about, this policy normally costs this much, but because you have an income of this much, you can get the subsidy that comes from the federal government. That goes away. Poof.
Wow.
And it goes to the insurers.
Nice.
But I don't know that.
Well, thank God for that work requirement.
Yeah, there you go. And then it decreases protections of the No Surprises Act, that was clarity in medical billing. Mm-hmm. So you could ask, like, how much is my gallbladder removal going to cost? Mm-hmm. And, break it down for me. What's the total? And so it takes away those protections. Another voice in here that's really benefiting is hospitals, and not necessarily rural hospitals.
What do you mean?
But for-profit hospitals.
Oh, sure.
So
anything for profit.
That comes up again and again and again. Decreased regulation on hospitals, increased funding, decreased, it's kind of like their responsibility to treat their healthcare consumers well. And that comes up again and again and again. Mm-hmm. So far, this is not looking like a deal for Del Norte at all. I saw nothing positive so far. Even when I read the articles that were positive about the medical changes from this, it mostly is thrill of personal responsibility.
There is this is the kind of thing that folks we'll get to that in the end. Okay. This is all part of the message at the end.
Right.
Yes, go ahead.
Right. And then the last one is COVID. This is awful.
Right.
So lots of COVID misinformation, like ridiculous. They said most of the people died because of social isolation, which is completely ignores the germ theory of disease.
Right. The last
and this was
years.
Interesting too to me because they demonized Fauci by name.
Wow.
Okay, they use other people's names, usually presidents, but talking more about roles or acts that they did. But they went after Fauci personally. And they're not the first people to do it, okay? The gay community was pretty mad at Fauci for a while. But they actually made amends and, saw the light and were more cooperative. But these people are not going to let Fauci go. I would worry for his health and safety.
Wow.
So they pretty much end public health measures like requirement during the next epidemic for isolation, mask requirements, and vaccine mandates. So even healthcare providers don't have to be vaccinated anymore, which is kind of ridiculous because we're all mandated to be vaccinated for the flu or for
because you come in contact with a
hepatitis
bunch of
B.
sick people.
Yeah, we hang out with sick people in tiny little rooms.
Jesus Christ.
Yeah, nobody knows how to wear it. Nobody, and there's a little bump of COVID right now in the community, and everybody has forgotten. We're back to the chin hammock and not really wearing masks properly at all. So, and then they try and get me to take mine off because they quote unquote can't hear me. But I am not gonna carry COVID to somebody else's newborn baby. So
Right.
get over it. They privatize large parts of the CDC. So the CDC becomes less policy making responsibilities and more data collection responsibilities, unless you're talking about gun control. So they're gonna target what they want the CDC to collect data on, and then they're going to make policies based on what they think, should reflect their political views.
Right. That
essentially.
comes first. That
Right.
consideration comes first.
Right. So, and it's going to make it easier to legally penalize people in the CDC who are brave and speaking out. Okay. So, so the scientists, if somebody has an politically unpopular viewpoint, then it's easier to suppress their voice. Wow. That kind of happened in China, didn't it, in the beginning of the pandemic? Look where that got them. So, and then it opens up government funding for alternative medicine. So the next epidemic, we can quack, quack, quack all we want. So I really want to emphasize this is a teeny tiny view of this document. It is impossible to read. It bases its conclusions on things that are politically minded and not based in reality. It is definitely capitalistic.
Oh, man.
It does not support individual choice in any way that makes sense to me. And I think it's going to be bad for Del Norte, mostly on the financial part.
Well, that's just financial things like this. I mean, and attitudes like in pressing situations like pandemics, we can turn around and lose 30, 40 local people here. Like would die because of something like this. You know what I mean? It's not just like financially. People could die because of these things.
Right. Completely. And clinics could go under.
Yeah.
Just saying.
Yeah. And that's where we all go for healthcare. That's where we all go. That we go to Open Door, we go to UIHS. If you go to the medical, if you go see a doctor and go sit in good for you. You're not in the majority in Del Norte.
Right. And who knows what kind of information you're getting. So you go to a visit, you have to pay more for it. You're not getting the services that you necessarily want. Medicine is no longer data-based, it's politically opinionated based.
Right.
And we saw that for a lot of the colleagues that I had. They didn't express it in their medical notes, but they expressed their political views, and it tainted their medicine.
Yeah.
And people were hurt by that.
Yeah, that very much happened. The whole fact of this, this burly, free market Christian hypocrisy is it's so hypocritical, and it's so antithetical to everything we were all taught about America. And that's what gets me too. Is we just really this is all go back to school sucking? Is that why it is? Did you not watch Schoolhouse Rock in the 70s as a kid? That's what I think is most upsetting about all of this for me. And I know there's so many real, and you're a compassionate person in healthcare. For me, it's just how stupid are these people who wrote this? That's what gets me.
It's like they're shooting themselves in the foot.
Right.
And they do their research, air quotes.
Yeah, exactly.
That nobody. I mean, I'm a pretty educated woman, and this was torture. to read this document.
And that's another thing I wanted to take care of as we're coming to the conclusion of this Health Matters in a bit here in a couple of minutes. I wanted to thank you for doing that for us. For me, I can't even. I hear things on the news about what's in it, and I just I know how I feel. I can't.
Broadcasting, they're coming for you, Paul.
Oh man,
yeah, there you go.
And that takes me to the thing I wanted to remember to bring up at the end, and that was how we can best defend ourselves against this BS, and that is what we're doing right now, which is talking about
I
this
think
openly.
education. That's why I felt strongly about doing this.
Mm-hmm. Yeah.
Because this man in this platform in Christian nationalism doesn't offer anything for Del Norte. It takes away from us.
Yeah.
And you guys are struggling out there. Everybody in this county is struggling. And this is only going to make it magnitudes of order worse. It's going to be less choice in medicine, more fiscal personal responsibility, which they think is a right. They think this is something that you should embrace. I'm not having it.
Wow.
And,
and
for worthless medicine.
They're selling you. They are attempting to sell us this lie that's based upon this incredibly ironic hypocrisy underneath it all that they don't see, and that they're trying to scrape together the white dregs of this country and say, hey, vote for us, not understanding that these are the people your life will become appreciably worse under Project 2025.
Yeah.
And they're hoping you're too stupid and not paying enough
Right.
attention and looking at Trump raising his hand after he got his ear nicked and thinking, oh, that's what I want, and not looking at what they're actually saying. Even Trump publicly has had to back away from a lot of this thing because people are going, you know what this says, right? And he doesn't know what it says because he's empty. But so yeah, the best we can do is to share. Here's what it says.
Right. Here's what it says, Del Norte. And is your health care a right or is it a privilege? And this doesn't make it a right, even though they put that label on it. It makes it very much a privilege.
Yeah, even more so. Even more than it is. Man. Wow. Okay, I don't know how I had a hard time dealing with this half hour. I don't know how you could even read this stuff. That is just... All right, so spread the word. Project 2025, what it means for you. And this is just the healthcare side of it.
Right. This is just
It's just a piece
this is
of the
just
healthcare
1%
Right.
of the healthcare side.
Right.
This is what I thought would affect Del Norte the most directly.
Wow. Yeah, man. All right. I have no idea how to say that other than how to conclude this show, other than just,
Do you want healthcare to be a right or a privilege?
Do you want to live in Iran? Do you want to live in Afghanistan? That's what we're talking about here.
Right.
American Taliban. This is exactly how it starts. And it started in the 80s with Reagan. Don't get me going. But
It did. The Heritage Project started in the 80s.
Yep.
Foundation.
So, there you go. Get out and vote. I don't know who you'll vote for. We just, before we went on and started recording this, just got the breaking news here on today is a Sunday that Biden has dropped out of the race. Whatever you think about that funnies things up even more. So I guess, I don't know, here's a random expression of hope for the future. That's how we'll end it. Anything else, Lynn?
I'm looking into moving to northern Italy.
Can we do Health Matters from northern Italy?
Yeah, we could.
Oh, God, thank you. All right. I'll have to learn how to say, all right, well, that's it for Health Matters in Italian. Lynn, again, thank you for doing this work and bringing this to the fore. And we'll get this to our listeners. Thanks.
Yeah, no problem.